Welcome back to another Generali Philippines webinar. I am Luisa Espinosa, Account Officer of Generali Philippines. After more than a year into the pandemic, Philippines has confirmed over 1 million of COVID-19 infections. Filipinos have been under the longest community quarantine, with varying safety measures implemented by the Philippine government. Numerous hospitals have reached full bed capacity as they struggle to cope with the increasing severe cases. So we have equipped ourselves to wear face masks and shields, to disinfect items we use, to maintain our distance from other people, and to limit our movement to what is considered essential. These are mere mitigation steps to slow down but not stop the spread of COVID-19. The question remains, how can we truly prevent the continuous spread of this pandemic? It is believed that the vaccination is an important tool in combating the pandemic. Vaccination is considered a safer way of protecting oneself against infection. For several years, we have protected ourselves against hepatitis, polio, and a lot more. And this afternoon, with the help of our distinguished guest speaker, we will all learn more about our current country situation and how the COVID-19 vaccine will be a strong force in eventually ending the pandemic. A few reminders before we start our program. Everyone will be put on mute for us to hear our speaker clearly during his talking session. You can still engage with us through the chat box below on your screen. Feel free to write down your questions for our speaker. The live Q&A box will be open during the latter part of the talk. You can type in your listed questions there, and we will do our best to answer it during the Q&A segment. To officially start this webinar, may I call on our Medical Director, Dr. Marian Lopez, for her opening remarks.
Thank you. Thank you, Luisa. So good afternoon, everyone. I would like to welcome every one of you to this webinar. In this age of pandemic and fake news, it will really be truly refreshing to hear actual facts about COVID and COVID vaccines. So for the next 2 hours, let's listen and learn from one of the most rational and sane voices during these times. So allow me to introduce our guest speaker for today. So he is a graduate of the Faculty of Medicine and Surgery of the University of Santo Tomas and one of the top-notchers in the medical board. He obtained his fellowship in cardiology in UPPGH, and he is the former president of the Philippine College of Physicians, an independent director for Philippine Health Insurance Corporation. He also served time as medical director for some multinational companies. He received numerous awards such as the Outstanding Filipino Physician in 2008 and the Outstanding Filipino in Medicine in 2010, the Outstanding Tomasian Awardee in Public Health in 2020. And most recently, he was assigned as a special advisor for the National Task Force Against COVID and currently the chairman for Kilusang Contra COVID or KICOVID. Everyone, let's welcome to our screen Dr. Anthony Liachon.
Can you hear me? Can you see me?
Yes.
Okay. Okay. Thank you very much, Dr. Marian Lopez, and thank you for the opportunity to add value to Generali. It's my pleasure to be invited to give you an update on the COVID-19, and I'd like to discuss on how to end the pandemic and focus on vaccination as the silver bullet to really end the pandemic. Let me start off with the flow of my presentation. I'd like to give you a snapshot of the global and the Philippine data, and perhaps give you a glimpse of the roadmap of the National Task Force or the National Action Plan, I had the opportunity to serve the National Task Force and the IATF for about 5 months, and perhaps my experience and of course my knowledge may actually help us in this particular situation in trying to end the pandemic. So I'd like, of course, to benchmark ourselves, the Philippines, with the best countries in the world. And perhaps after 1 year on quarantine, we have the longest lockdown in the world. Perhaps the question is what went well, what went wrong, and what can be done in order really to end the pandemic. And I think we need to understand the vaccination, to me, is the one that can actually lead to achieving this particular coveted goal. And the last question is, what is basically the factors to really end the pandemic? And I'd like to mention here the science-based approach and the process of the vaccination, the ideal one, which we have seen in many of the best countries in the world. Now, I had the greatest opportunity to work with the greatest minds in our government, and this was taken at Camp Aguinaldo. Um, I was It was on March 15 when the president imposed the executive order placing the National Capital Region in the entire Luzon um, in a ECQ, or enhanced community quarantine. And after a week, I received a call from the palace, and I was summoned and designated to report to Secretary Charlie Galvez, the National Task Force uh, chair, and of course, right now, the current vaccine czar. On my left is the Secretary of the DILG, Secretary Ed Año, and in the middle is the Secretary of National Defense. He is the current chair of the National Action Plan. So the org structure basically is like this. You have the National Action Plan chair, that is Secretary Delfin Lorenzana. And then this will actually be divided into two main groups, the IATF, headed by Secretary Duque and co-chaired by Secretary Carlo Nograles, with Secretary Ed Año as the vice chair to the National Action Plan. And the other arm is the National Task Force headed by Secretary Cardi Galvez. So I'm reporting to Secretary Galvez as the technical and medical advisor for COVID. Now, in doing this particular advocacy, so after my stint at the National Task Force, I went on, I rested for a while, and then I was summoned to lead a multi-sectoral organization, the civil society group supporting the Quezon City. So I'm the current head of the Kill COVID, a group of professionals and other organizations, medical organizations and civic society. I'm also advisor to Mayor Isco and to Mayor Toby. And I had chats, of course, once in a while with Mayor Benji Magalong and Secretary Ed Año. Now, it takes a great deal of bravery, according to Harry Potter, to stand up to our enemies, but just as much to stand up to our friends. Kasi ang problem natin in this situation, we are on advocacy. And of course, truth is very important. And even if your opinions are actually divergent to the government, then you need to understand that as a clinician, as a physician, your role is basically to tell the truth based on fact, based on information, and of course, based on rational thinking. So talagang ganun lang yun. We have to accept that. Now, after 1 year on lockdown, where are we right now? Diba? Yan ang main question natin eh. Basically, we're number one country, we're the number one country in Asia with the active cases. We're still on quarantine when rest of the Asian countries um, have gone back already to their pre-pandemic times. And according, of course, to a lot of economists and epidemiologists, that we may actually go back to our pre-pandemic time by the end of 2022. Now, if there's one thing that I'd like you to understand, and as a takeaway message, is to understand this particular graph. And this particular graph is we call the hammer and dance concept. And I presented this on my third or fourth day at the National Task Force, and I presented this at the IATF. So my role is basically to provide information so that I'll be able to advise our leaders on how to approach the problem. And this one is from the great social writer Thomas Pueyo, when he conceptualized this particular hammer and dance concept. So on the vertical axis, this would actually correspond to the number of cases. And if you do nothing, you have a steep rise. Now, if you do mitigation measures, then perhaps you have a change in the curve. Now, during the time when we had this particular virus attacking us, we had no recourse at the time but to put the entire country on a lockdown, right? And basically the aim, the fundamental principle in epidemic, dapat hindi tayo gumalaw to slow down the virus. And by doing that, we have to stay home. But this would actually be just buying time. So usually the hammer concept is basically up to around 2 or 3 months. And while we do this, while we were in lockdown, we need to understand the problem. We need to, cut the virus growth, understand the cases, recruit more personnel. You have to improve on treatment, and of course, ramp up on testings and contact tracings, and build healthcare capacity. Now, once we have controlled the viral transmission, that is the time that we will actually have this particular graph. And that's the time we reopen the economy. Never that we should actually open the economy when the cases are still not controllable. And that's one of the basic things na nangyayari in our country. So hindi pa tayo ready, nagbubukas tayo, so we see surges every now and then. But during the dancing period, we should keep our reproduction number. The RO or the R naught, it should be less than 1. It means the level of transmission and contagiousness. But even during the time that we are right now open to, in terms of the economy, we need to do proper testing, contact tracing, quarantine, of course, and isolation. And we need a massive public education campaign on hygiene, and of course, ban large gatherings. And basically, this is the concept, the hammer and dance. And if you know this particular concept, I don't think you will be having problems that we are having right now. Now, we are right now in the worst situation. We have an economic depression, the worst economic depression since World War II, when the rest of the countries nakabalik na. So this is the Philippines, that's the red one, and as you can see, based on our GDP and of course inflation, ang Pilipinas is at the lowest, while yung nakabalik na are basically the countries, particularly Vietnam, Vietnam and other countries. No? So itong problema natin. So the problem with not addressing the pandemic in the soonest time possible would actually create problems right now. And there's really no dichotomy between health economy. Health is the new wealth, and basically having a healthy situation would actually lead to, of course, opening up the economy. We need to understand that we cannot reopen the economy as long as the virus is not controlled. And if we don't understand this problem, then we are actually part of this particular situation. Now, this is the one particular slide that I'd like to emphasize. So this is the y-axis or the vertical axis, and this is the number of cases, right? And then, of course, the economic managers, of course, during the time of the surge, sometime July and August, and sometime in February, when we had these particular cases, and then they suggested that, oh, perhaps, Mr. President, we would like to go to the modified GCQ. Balik na ho natin, Mr. President. But they were not, observing the global picture when there were many variants available or perhaps evident in other countries, like for example in the UK, yeah, and then you have the South African and the Brazilian. So hindi nabantayan ng border control. And then ang cases natin, I'm not sure whether looking at the DOH bulletin every 4 o'clock PM, that's every day. I usually look at that, and then perhaps you can have a snapshot on where we are going, no? So hindi ko alam, no? So there were those times na it's quite unbelievable na they would like to open the cinemas, they would like to open um, they would like to allow and I actually posted on Twitter and Facebook that this is not the time to shift to the modified GCQ because we are not ready and because we have limited supply. It's a good thing that the president turned down or vetoed this particular request because after 1 week we had that problem. So ito yung magiging problema natin, no? When we try to reopen the economy, all right, and we are not ready and we overreacted, this what we na nangyari sa atin, and that what happened also in other countries na unsuccessful in terms of their response to the pandemic. Now, perhaps you would wonder, no, paano nagawa yung ECQ, MECQ, ECQ, and modified GCQ. So we conceptualize these particular interventions in coordination with the medical societies and, of course, the military generals. So when we mean ECQ, there would be no movement regardless of age and health status, minimal economic activity, and no transportation activity. And of course, there's suspension of classes. Ang kaibahan lang when you mean modified ECQ, that's about operation of selected manufacturing processing up to 50% of the workforce. And then when we mean GCQ, that's about opening up government and private industries to 75%. And we mean modified GCQ, that's actually permissive social economic activities. But I don't think that we are right now on the classic ECQ or MECQ. Because when you move around, nakikita natin, medyo lax right now. And we see a lot of our citizens right now walking around. So hindi tayo masyadong behave at this point in time. So I think complacency has set in our situation. That's why it's a good thing that they actually modified it because I don't think we can accept the fact na naka-modified ECQ tayo but we are actually on GCQ. ECQ was a different scenario last year. And I don't believe right now, to tell you honestly, on quarantine classifications. Because I think we need to fight it off right now by adhering to the minimum health standards and, of course, to health protocol. There's no way that we cannot go back to the way we were because many people will suffer and we need really a science-based approach in order to address the problem. Now, may plan ba talaga ang government? Yes, there's a plan. We conceptualize this, and this is what we call the PDITR, and of course the reintegration. Ang weakest link ng government is actually on two things. On the prevention side, hindi tayo nagkaroon kasi ng massive public communication campaign. That's on the preventive side, no? Which is structured And I think it should be actually inserted into the curriculum of the primary and secondary education, as well as on the HR programs. Eh. And I think those guidelines, if simplified, would have helped actually our situation in trying to address the COVID situation. Our weakest link is basically on the testing set, and of course the contact testings. Testings is still very low. We have not tested enough. It is important that we need to test so that we would know who would actually go to the office and who would stay at home. Virtually, wala talaga tayong contact tracings according to Mayor Benji Magalong. Our ratio should be 1:37 up to 5 levels. Ang ating contact tracings is 1 to 3. So,
See?
but those are very important measures in order to manage the pandemic. And I don't think we have been successful in the detection process. As a physician, you need to be very strong on the diagnosis part in order to treat. A wrong diagnosis will always lead to a wrong treatment. And usually as a physician, you should be able to make a diagnosis without the benefit of laboratory based on history and PE, and of course based on certain tests. But I think we have failed big time in terms of our testing and contact tracings. Now, this is the global picture. Still, the number one in the world is actually the US. But they are, successful in addressing the problem at this point in time because they have the high quality vaccines, Pfizer, Moderna, and Johnson and Johnson. The centrality of the focus right now on the in the world right now is India, with the number of cases reaching 400,000 and the number of deaths of 4,000. There are about 160 million cases right now, with almost 30 million deaths. And what is really very alarming is the spread of the Indian variant across the globe. And we will discuss that later on in our presentation. Now, in Asia, as you can see, starting last year, only 2 countries at that time were not able to flatten the curve. And as you can see, the other countries have been successful except for Indonesia. But Indonesia right now, because of their good vaccination program initiated by their president, last January, they have this particular surge. And then we were okay last January, but we had a surge early March with a downward trajectory right now. But the other countries, even without the benefit of vaccination, you can see just using the science, using prevention, detection, isolation, and treatment, they were able to control the pandemic. Now look at this. No, if you look at this particular chart from the John Hopkins, ang Pilipinas is basically parang India because we had the same time of surge at the time. So when we had the lockdown from March to July, nagkaroon tayo ng surge because of the opening of the economy. Remember, when there's mobility, there is always this problem of surge. And when we prematurely reopen the economy without um, without containing or of course addressing the new cases, we will run into problem. Remember, ang fundamental principle sa epidemic is actually mobility. And that's why social distancing is the most important measure, bigger than, or greater than the impact of your face mask and your face shield. Because social distancing would account for about more than 95% in terms of risk reduction. Now, ang nangyari sa India noon, nagkaroon sila ng political gatherings initiated by their current Prime Minister, Narendra Modi. So, again, complacency ang nangyari after there's downward trajectory. And then, hindi nila na-realize that that they had this particular variant, the 1617, a ferocious one with double mutation. And considering India is the number one country in the world in terms of the population, but despite having the most number of companies and drugs, and consider that this is a country that would be able to produce vaccine, tinan nyo naman ang cases nila. It's almost right now a vertical rise, no? Hindi man lang parang Mayon volcano. It's really like this. Now, so I researched if this is the same scenario. Still they have these cases, but their cases have gone down from 400,000 to 220,000 cases. All right, with around 3,000 deaths per day, no? So medyo bumaba na yung sa India, but still very high. Nagkaroon sila ng downward trajectory because of their lockdowns. Ang sagot kasi whenever you have an acute cases is talagang lockdown. We don't have any choice. We have to do that, and that's the reason why last year, and of course 2 or 3 months ago, nagkaroon tayo ng lockdown because you cannot control. You have to slow down the virus. Now, so I'd like to orient you with the DOH bulletin data that is being churned out every 4 o'clock in the afternoon. Now, I'd like to draw your attention to the number of cases. The highest na nagkaroon tayo is 15,000 cases. So we're right now hovering sa 4 to 6,000. Our target should be less than 1,000. Now, we don't want cases like this because this can lead to the number of deaths. One thing you need to understand is the positivity rate. The positivity rate is the number of positive tests over the number of positive tests over the number of the tests done for that day. And based on the World Health Organization benchmark, it should be less than 5%. Now, the reason for this is that we have a low testing capacity. We need to understand, in order to diagnose, we need to double this particular output to 100,000. But this has been the case since 3 months ago. Ewan ko, for some reason, hindi nila na-fulfill. I think the basic reason is that in other countries, libre kasi ang testing. Tayo very exorbitant, hindi affordable, hindi acceptable. Some would charge 10,000, 8,000. So for one De La Cruz, I don't think you'll be able to afford that. And that's the problem na nakikita natin. Now, once we have positivity rate less than 5% and the cases are down and there will be 0 deaths, that's the time that we will say that we are okay. Now, ano ba yung sinasabing healthcare capacity? Pagka puno ang ICU mo, more than 70%, ang ibig sabihin, hindi na makapag-admit. ICU, isolation beds, and ward. And during the time, if you remember at that time, no, na ang queue ay 100, this rose to around mga 75 to about 80%. Ganun kapuno ng hospital. And our positivity rate at that time was 25%. And the highest that we reached is about 15,000. And there were deaths about 400 a day. So right now, I would say we're not yet out of the woods. Yan ang gusto kong sabihin sa inyo. And we cannot be complacent because there are still active cases that can lead to deaths and then that can lead to hospitalization. We need to do more testings so that we'll be able to isolate and then trace and then isolate and quarantine. Now, look at the graph ng Philippines. No? This was yesterday. And as you can see, ito yung lockdown natin last year for 4 months. And then we prematurely opened the economy. Di pa tayo masyadong ready nun. Ang peak natin that time, 6,000. And this was the time when the medical community called for a timeout and asking for an ECQ. But the IAT and the president granted an MECQ. But that resulted in a gradual downward trajectory that actually spun up to even during the time of the typhoons, during the holiday season, during the Nazareno, even during the Chinese New Year and Valentine's Day. but they were not able to monitor here the arrival of the variants, the UK, the South Africa, and the South and the Brazilian. And together with complacency of our citizens, plus of course the aggressive reopening of the economy, particularly the Department of the Trade and Industry, and of course the NEDA, and of course the tourism, eto nangyari sa atin. Ang peak natin was actually 15,000. And then nag-ECQ tayo, then MECQ. We're right now on a downward trajectory. Now, ang total natin last, since the first time, a few index cases, 1,184. 1,184,706 cases. Ito ang total cases natin. Ang total number of deaths natin ay 20,000. So just to show you, yung China, which is the original country that introduced us to the Wuhan virus, ended up with 80,000 total cases and only 4,000 deaths, as opposed to the Philippines, na 1 million, almost 1,220,000 deaths. Sa kanila, ang deaths sila 4,000. So, biro mo lang, tayo, no? We are in this kind of situation. And we're not a rich country. We're actually low to middle income country. And the longer that we stay in particular lockdown, that would mean, of course, economic depression, more economic depression, and more, of course, sufferings for our people. Now, I have to tell you that even with your mask, your face shield, no? Even if you have your mask, you have your face shields with you, and social distancing, right? Coronavirus is airborne and can be transmitted 6 feet away, according to the CDC. So although infection through inhalation or diseases greater than 6 feet through an infectious source are less likely than at closer diseases, this phenomenon has been repeatedly documented. And ang sinasabi ko lang is that if we are not going to think of a rational reason or something that is definite to end the pandemic, and we're going to end up the rest of our lives wearing masks and face shields. No way. I mean, there must be a definite way of ending the pandemic. We cannot be forever locked down and staying in our houses or in our homes wearing face masks or buy everything, really, all this protective gear. Kailangan maibalik natin. We need to bring back normalcy into our lives. No? Now, so we need to understand that each Filipino citizen should be able to test. Diba? So we need to understand that in the US and other countries, they are empowered to do the testing. And testing is who is infected. So, kunyari, may flu-like manifestation ka, then you need to understand that perhaps you need to isolate right away, right? And prevent those infection from being spread, no? Ngayon, kung negative ka, then you can go back to office. But if you're positive, then you should isolate and do your contact tracing within the family. Who are those in contact with the infected? And then prevent the contacts from infecting each other. So what I'm trying to say, each generally citizen or each generally colleague or each Filipino citizen should be empowered to test, to trace, to isolate, and quarantine. Yan ang ibig kong sabihin. Because these are the 4 pillars to control the COVID-19. And these 4 pillars have been the secret weapons of the other countries, even in the absence of the bakuna. Yan ang problema. Kaya lang, we fail big time in the testings and in the contact tracings. And these are the 2 most important things na kailangan natin maintindihan. And by doing all these things pa rin over and over and again and expecting a different results, I think that is insanity according to Albert Einstein. Now, mass testing, kaya hindi rin naiintindihan, with due apologies to my former colleagues at the National Task Force. Mass testing is not really testing the entire population, but rather a large part of it. And it is defined based on the IMF, based on a paper written by economists and epidemiologists, that it should be 10 to 20% of the nation's population per day, starting from January of last year to April 4. But we only did only about 9% of the 110 million. So, kaya ang nangyari, hindi natin nadadiagnose. Pakalat-kalat pa rin yung positive, hindi natin na-isolate. Yan ang problema natin. And then we reopen the economy. And of course, the Juan de la Cruz naman, kung if you're a wage earner earning let's say 800 to 1,000, can you afford let's say a 4,000 testing? So hindi. So either you conceal whether you have symptoms or not. So yun ang problema natin. But in other countries, libre yan eh. So nangyayari, nape-prevent nila yung illnesses nila because nasasagot nila yan eh. So by not addressing this particular fundamental principle that testings are very important as one pillar, yan ang magiging problema natin. Pangalawa, wala tayong contact tracing. That's another problem of ours. Now, look at the Philippine situation natin. If you will understand yung Philippine situation natin. Downward pa rin tayo. And ang positivity rate natin ay 13% or ganun pa rin ang cases natin eh. So we failed eh. We failed in the contact tracings. That was Mayor Benji Magalong is my dear friend, no? And he actually admitted that in a Congress hearing, it's practically non-existent. Eh. That's why we have problems right now in other areas of the country, particularly in Palawan ngayon. Even our treatment SAR, my good friend, Undersecretary Bong Vega, that the hospitals are still swamped with patients right now kasi ang daming cases eh. Medyo maluwag na lang ng konti ngayon because of the lockdown. But we're not yet out of the woods, no? Makikita natin na it's still very difficult to be admitted in the hospital. Now, even our quarantine and isolation facilities are, no, they're trying to build it up right now. And I don't think they need really to relax at this point in time kasi surges can really happen. So we failed basically, most importantly, in the testing and the contact tracings. And we're struggling right now on the treatment as well as the isolation and quarantine facilities. Now those countries who are not able to get out of the pandemic fare badly. Most Asian countries fare relatively well on both metrics. Fewer deaths, small economy. And that's Vietnam, China, and of course South Korea. And then Indonesia, successful na ngayon. Japan may konting surge, but basically okay, New Zealand. No? Now, those countries, ang India nag-suffer, no? Right now. Yung at the time, ang US, during the time of Donald Trump, and then Brazil, and then UK, the presidents of these countries, no, more deaths and small economic hit, contracted the virus. So if you will not apply science, no, makikita mo that can also be reflected in a survey, no. And those countries which have adopted science approach are actually successful. While those countries during the time, so when this was done, during the time of Donald Trump, nandun ang United States at the bottom with Brazil and Britain. And of course, Boris Johnson contracted the virus. Bolsonaro of Brazil contracted the virus. Donald Trump contracted the virus. While Jacinda Ardern, despite the absence of vaccines, she just, adhered to the protocol and other countries. So they have been, of course, successful. Now, if you look at this particular data coming from the Johns Hopkins, Ang Vietnam, which is a poorer country than the Philippines, 10 times poorer than the Philippines. Tinan niyo sila flat, no? Except for some cases because of the variants, eh. Once na nagkaroon ng mobility, no? So affected talaga tayo by the variants. But you see, all year round, okay sila. But, their cases, but the cases in Vietnam are a far cry from the Philippines kasi 156 tayo, nasa 4,000 cases, eh. When you look at Australia and New Zealand, at this point in time, wala sila ding masyadong bakuna, but they're okay. And you look at the Australian data yesterday, look at this, na-flatten na nila yung curve nila September, and you can see the curve nila even in the absence of bakuna. Kasi ang preference nila ay Astra, but nung nagkaroon ng konting problema ang Astra, and then of course wala silang adequate vaccine supply, even they're a rich country, tinan mo. What I'm trying to say, ladies and gentlemen, is that you don't really need a vaccine in order to flatten the curve. Eh. But you can never be you will never be the same country as before kung wala kang bakuna. And definitely you will be on lockdown forever. That's why Australia, napakahigpit niyan, eh. At this moment, there are 35,000 Australians all over the world na hindi makauwi. Kasi ang strategy of Australia is actually border control. Now, if you look at New Zealand, another disciplined country, as early as June last year, flat yung curve nila. Look at the number of cases. My God. Look at the number of Look at the number of cases for New Zealand. Zero number of cases. That's almost impossible to be achieved, no? Now, this one is my favorite slide, no? And this is from Ian McKay. I think for more than a year, we have been so disciplined in terms of social distancing, staying at home. We are a master of wearing face masks, hand hygiene, and of course, doing all of this stuff, no? Yan ang ating personal responsibility. But the government, ito yung shared responsibility of each citizen with the government. Yung fast and sensitive testing, ventilation, outdoor and indoor, the government messaging, yan dyan tayo medyo mahina. We're not trying to admit na meron tayong problema. Excellent pa rin ang ating assessment. Yan ang problema natin. Financial support, naubos tayo sa ayuda rather than focus on the testings and the contact tracings. And then, of course, eto na ngayon tayo sa vaccines. And of course, you know what happened here. Hindi tayo nag-queue up early time when somebody dropped the ball. We should have gotten the vaccines in January because we were negotiating in July, and eto nangyari sa atin. And the rest is, of course, history. And for us to be back to our normal lives, we need to have the vaccines really procured as soon as possible kung hindi magkakaproblema tayo. So this is a classical metaphor or analogy. Now, because each intervention is just like a piece of or a slice of the cheese, and each intervention has imperfection, and multiple layers will actually improve the success. But to me, the silver bullet and the one separating us from this particular lockdown, and of course to freedom, and of course herd immunity and economic recovery is actually the vaccines. Now siguro gusto niyo maintindihan, no? And FYI, I used to work with a pharmaceutical company, and I graduated from UST and went on to UP. And during the time that I needed, extra income because I married early, nagkaroon ako ng premature kid, and I had to work hard. And then through some twist of fate, I was able to work with Pfizer. And of course, I was I was assigned to launch the biggest product ever launched in history, and that's Lipitor. So I went to New York for many times para mag-launch ng mga produkto, Norvas, Citromax, and all. And I quit in 2010 with the death of my sister, no? So I have extensive knowledge on pharmaceutical medicines and of course vaccines, no? Now, kung isipin natin ng vaccines, there are actually many types eh, but we will focus on the ones that are new para maintindihan nating lahat. Ang bago kasing vaccines is in the RNA, mRNA, and that's Pfizer and Moderna. And the viral vector that is using a virus as a conduit para makapasok inside the cell, no? Yung ordinary nating ginagamit na virus is the inactivated. Ito yung Sinovac and of course Sinopharm. Now, ito yung meron sa America right now. And basically, the mRNA vaccines work by introducing an mRNA, a genetic code, no, that will actually enter the cell, that will stimulate immunity. Ganun din ang concept nito, but using another particular mechanism. So, ganito lang yan. So, when you launch a product, you need $1 billion in order to launch a product into the market. So when the vaccines were conceptualized after the genetic code was revealed by China, kasi at the time in January, buti na lang mabait pa rin ang China, binigay sa WHO yung code. So several companies work on the vaccines, no? So ang early candidates 154, and then phase 1, healthy young individuals 19, phase 2, and then phase 3. Pag nandito ka sa phase 3, 22 na yung candidates mo, this would be the time na you have to enroll about 30 to 40,000 cases and you will study the efficacy, yung galing, and then the safety, yung kaligtasan ng produkto. And then you'll given 21 days after the termination of the last patient, no? And then submit that to the FDA. Ang nakatapos ay 10 bakuna submitted to the FDA. And then, ang nandyan, of course, you have the mRNA, dalawa, Pfizer, Moderna, the viral vector, that's Astra, Gamaleya, and of course, Johnson & Johnson, may protein-based din tayo. So, ganyan ang history niya. And they were able to accomplish that in record time na 10 months because meron ng initial investment during the SARS-1 eh, and then the MERS-CoV eh. And kaya mabilis tayo nakatapos dito. Now, ganito itsura ng COVID virus. It's just like parang a crown. No? Kung napanood nyo yun, The Crown, no? With Queen Elizabeth, para talaga siyang crown. And what is important, studied siya by this particular spike protein. No? And this one would facilitate the entry into the cell. So ganito itsura ng virus on the electron microscope. So, ganito ang mangyayari niyan. So, there are 3 types of coronavirus vaccines in development. Napakadaling intindihin lang yan. So, you have the usual protein-based, let's say Sinovac and Sinopharm. Nandito siya. The spike protein is purified and injected, right? And then, that will produce the antibody. So, yun yung traditional, no? Parang mga measles dati. Now, pag ginamit mo naman viral vector, right? The spike protein gene is purified. The adenovirus, parang siyang cold virus na mahina lang. But that will produce the spike protein na mahina lang. And then, papasok siya sa cell that will induce the antibodies. The antibodies will protect us. No? And then, mRNA naman is basically here. Meron siyang code. So, the spike protein is purified, nililinis and injected, and then this will produce a harmless spike protein that will actually enter the body, magkakaroon tayo ng antibody. So basically, the vaccines will help you understand, will help your body to make the antibodies. Now, on December 8, 2020, history, the first human being to be vaccinated with a COVID vaccine, that's a Pfizer vaccine, is Margaret Keenan. Kaya I remember that kasi it's on December 8, Immaculate Conception. And the name of this is kapangalan ng misis ko, Dr. Marge, no? So Margaret Keenan. And a Filipino nurse injected a particular vaccine by the name of May Parsons, who worked in UK for almost 25 years. Now, basically, all the vaccines, their goal is to produce an antibody that will destroy this particular COVID virus. Now, ngayon, ang virus is very wily. They will produce variants Kaya nagbabago ng anyo. You remember your SARS-1 and then your MERS-CoV, tapos suddenly nawala for many years, bumalik. No? Ang problema kasi nangyayari sa tao, they actually would engage yung mga animals, sirain ang environment. So may nag-revenge ngayon ng mga animals, pati virus nila yan. So December of 2019, nag-umpisa yan December 8 again, 2019. And then kumalat sa China. All right? So the rest is history. Yung cause of the July-August surge was due to this particular variant, D614G. And then on September 20 of last year, you have the B117, that's the UK. October, South Africa naman, B1351. And then the very virulent and ferocious Brazilian that time. Ngayon, nagkaroon din tayo ng variant. Hindi pa nga tayo nakadiscover, Japanese pa nga And then nakapunta sa UK, kaya ban tayo ngayon sa UK because of this particular variant. And of course, India, the name of the variant is B.1617. And it has actually entered the country. Now, during the development, kanya-kanyang efficacy rate yan. Ang ibig sabihin ng efficacy rate, you have a clinical trial, the percentage ng pasyente na hindi mahahawa, that is the efficacy rate versus placebo. So ang pinakamataas, of course, is Pfizer, yung #1 company in the world, 95%. Moderna, 94.5%. This is a UK product, 60 to 92%. This one is 50 to 90%. Gamaleya, a Russian vaccine, and then Johnson & Johnson, an American vaccine, and then Novavax, of course, coming of the US, Sinagagawin from India. Now, ang magkakapatid dyan, sister vaccine, ay yung mRNA, Pfizer and Moderna, 2 doses. And then AstraZeneca, adenovirus, Gamaleya, and Johnson & Johnson. Lahat sila 2 doses except for one, which is Johnson & Johnson. So yung efficacy rate on the clinical trial yan. But when you use that in the real world, ang tawag effectiveness, okay silang lahat The protection from severe disease and protection from hospitalization, 90% to 100%. Right? So yan ang ibig sabihin natin. But of course, certain countries, of course, gusto nila yung the vaccines which are coming from the US kasi una silang lumabas So yan ang nangyayari sa atin. So what we have right now in the Philippines, may approval tayo Pfizer, Moderna, AstraZeneca, Sinovac, Gamaleya right now. But we have a dominant Sinovac for the inventory and of course AstraZeneca. All right? So yan ang storya natin. So whatever vaccines na gamitin nyo, the dominant strain pa rin is the Chinese variant. And that's the reason why you need to be vaccinated so that you will be protected from having a severe disease that will lead to hospitalization and of course death. And napakamahal naman to be admitted in the hospital because the total bill will be about 1.5 million. Puti na lang may PhilHealth ka. But who would want to be admitted in the hospital? So basically, yun ang galing sa America, Pfizer, Moderna, Novavax, and hopefully dadating na yung ating mga supplies. And of course, AstraZeneca from UK. And then Janssen. Okay, that is the Johnson and Johnson. This is the Sinovac, 50 to 75%. And of course, this is Sinopharm. This is the one injected sa presidente kahit wala pang EUA. Kaya nagka-problema dito. This is the Russian vaccine. That's the 91%. All right. So ganyan yan, no? All right. So basically, a vaccine works by using a weakened, mahina, inactive part of a virus to identify it and trigger an immune response. Yung lagi kong sinasabi, mahinang na virus lang, parang kurot lang, but that will actually trigger the immune response. Now, tungkol naman sa variant, ito, okay, pag-usapan natin. Alin sa mga bakuna natin ang can address the variant, no? Okay, lahat for the mRNA vaccine that is Pfizer and Moderna, lahat sila kaya. Here, South Africa, here, Brazil, Japan, here, New York, here, California, here, India, here. The other one, which is a strong one, is the AstraZeneca, except for the South Africa. Now, since ang Sinovac and Sinopharm, limited only to 14 countries, hindi na pag-aralan in other countries. Right? So, ang strategy ko dyan, if you were injected with Sinovac and Sinopharm, ang booster dose nyo should be an mRNA vaccine. Either Pfizer or Moderna, or perhaps AstraZeneca. Kasi that can address the variants na nakikita natin. Right? But at this point in time, since what we have right now in our country dominantly is the Sinovac at 66%, then you need to be injected to be protected from the Chinese vaccine unless unless you have other plans, no? Ako, ang in-inject ko, mamaya ako sasabihin sa inyo. So what we have in the pipeline, we have 7.8 million doses. Ang pinakamarami natin ay Sinovac at 5.5 and then Astra at 2 million. Kaya magmadali kayo. I think it will expire in July. And we have only a few 193,000 doses of Pfizer. Pero may dadating tayo. We ordered 40 million doses. But for June, ito lang dadating sa atin. And I think we need to hurry up because of the rainy season. It will be very difficult na magpabakuna during the rainy season. Now, the Indian variant has been found in 17 countries all across the globe. Nakarating na rin sa Pilipinas. So, you want to crush the COVID, no? This is by Eric Topol, a famous cardiologist and researcher. You need to really get the positivity rate at 0.2%, just like UK and Israel. And the current US test positivity is 3.9%. So if you look at the countries na successful right now, pinaka-successful would be Israel. Look at the Israel and United Kingdom, and then ang US. Ang US was coming from this one, no? During the time of Donald Trump, right? Because of Joe Biden's leadership, tama ang nangyari. Now, this one is the United Kingdom. As you can see here in January, with aggressive vaccination with Pfizer. Kasi nag-start sila ng vaccination December 8 no, kay Margaret Keenan. Look what happened to the UK right now. 2,000 na lang yung cases sila. And then flattening curve. This is the UK. So they have many cases. Wala silang lockdown. Yung lockdown lang nila talagang hindi kasi tulad ng ating lockdown. And look at these three countries na successful using the first dose, and then look at the hospitalizations, talagang mabababa. When they use the second dose, no, kung fully vaccinated na, Israel, look at Israel, almost 60% of the population, UK 21%, 30%. Pag sinabi natin full vaccinated ka, 2 weeks after the second dose, you are fully vaccinated. Hindi ibig sabihin hindi ka mahahawa, magkakaroon ka lang ng parang mild flu, but you will never be hospitalized or magkakaroon ka ng severe disease that can lead to death. And that is the value of vaccination of whatever form or whatever brand because of the protection from hospitalization and also the number of deaths. That's why when I was interviewed, sabi ko, well, perhaps masyado malaki yung 70 million of the population natin. And perhaps we should emulate the Israel model. Kasi the Israel population is around 10 million. Ang Philippines naman ay 13 million. The herd immunity for Israel would be 7 million. Nasa 6 million na sila. Ang Philippines ay 9 million. So if we focus, let's say, on an NCR+, then we have the opportunity to reach our target ng herd immunity. Napakagaling ng the Pfizer vaccine in Israel. Kung makikita mo, almost 90% lahat in preventing SARS infection, fever, admissions, serious hospital deaths. Look at these numbers, no? 7 days lang from those two and 14 days. Yeah. So, napakagaling. So, makikita mo almost 90% na. Now, look at Israel, no? Ang Israel during the, January, look at the cases ng Israel. But with vaccination in April, this is just about 4 months. Dapa na kagad sila. And their end result would be like this. They ditch the masks. The masks are no longer required outdoors. The schools across Israel reported okay na sila. Wala nang mask, no? And look at the Israel right now, no? This one. Ito, May 23 to. Today is May 25. Look at the number of cases nila. It's only 11. Ito na sila. And it is because of vaccination. Ang kaibahan lang natin sa Israel, they are very agile. They have sense of urgency. They have political resolve. They have passion. They're patriotics, no? Yan ang kaibahan ng ating bansa compared with these countries. Now, regarding the positivity test nila Manila, look at the positivity test nila, 0.2%, which is way below the 5% ng WHO. How about the US? This is President Joe Biden, no? Nagpa-inject siya December 21. And what happened? By the end of May, Biden administration will secure enough doses to vaccinate all Americans. And look at the US right now. 20 ang cases lang nila is 14,000. Dati yan, hundreds of thousands, right? Ang galing, oh. Look at these cases nila. So after the start of the vaccination in December, look at what happened to the US population. And they will declare sa 4th of July ang kanilang freedom. And they will reach herd immunity. So in 6 months' time, magagawa nila yan. Kung focus lang tayo, I think we can still do it. Now, ang problema natin is our vaccination is really slow, no? And this is the way to report it, the percentage to the population, not the administered dose. Pag sinabi natin na tayo ay second to the last, tama itong pagre-report ito kasi this is based on the percentage of population administered dose. Ang pagre-report kasi natin mali. Pagre-report natin iba. Dapat when we report is the number of the population natin. Kunyari administered dose. Hindi naman tayo o-order na hindi naman o-order ng Singapore kasi 5 billion lang yung population nila. Ang ginagawa natin, administered dose and lalabas, number 2 tayo sa Asia. That's not the way to report it. You should report it as a percentage of the population fully vaccinated. Pag gagawin natin to, following the world data, then we're second to the last or third to the last. And the number 1, of course, is Singapore, Hong Kong, and the other countries. Now, if you look at Singapore, actually, hindi na nila halos kailangan ng bakuna because tinan mo ang cases lang nila o 25 lang. But still, they want to have themselves vaccinated kahit flat sila halos And look at Taiwan. Ang Taiwan talagang flat. Ang nangyari lang because of some foreign travelers, yung mga pilots sila, nagkaroon ng problema because of the entry of some variants, no? Kaya nagkameron. But look at Taiwan, no? And kokonti naman yung cases nila, manageable at 100, 450. But they were very strict. So what I'm saying, ladies and gentlemen, this flat line or flattening of the curve nila, this is without vaccination. This is purely science. Testing, isolation, track, contact tracing, quarantine. Lalo na kung magbabakuna ka pa. Now, kung tingin natin bakuna, Pfizer ba? No. Because Joko Widodo used Sinovac and Astra. And look what happened to Indonesia. Yung Indonesia in February, ang taas-taas. 10,000 cases sila. But look what happened to Indonesia with vaccination. Baba na kaagad sila. So it's important right now that we focus, regardless of the vaccines, no? Whether Sinovac ka, whether Astra ka, whether Pfizer ka, is basically the agility, the sense of urgency to vaccinate the population. Now, this one is the priority listing. A1, frontline workers, senior citizen. A2, those with comorbid conditions, hypertension, diabetes, cancer. A4, essential workers, and then poor families. Ang suggestion natin is fast track this one so that we can move to A4 because they're the ones actually working right now. So if these are protected, particularly, then they will not be able to bring the virus sa kanilang mga magulang. Kasi usually the A4 would unintentionally bring the virus at home to affect their elderly loved ones. Ganyan na nangyayari. Ang vulnerable pa naman, sila yung hospital. Now, I had my first injection March 11, and my next and my final vaccine will be tomorrow. Yay! So, tapos na ako. And I'm fully vaccinated 2 weeks after that, no? And hopefully, I'll be protected for 6 months to a year, then I have the full vaccine, no? So, kailangan talaga magbakuna tayo. The target of the vaccine SAR is to have the vaccination. I don't think it's the entire country, but perhaps the NCR plus by November. So I think we need to help the government. No? They need to use the malls. In the States, Walgreens ang ginagamit, CVS, use pharmacy outlets, and other private corporations. No, it would be in the best interest if the private sector will be involved in the vaccination so that the herd immunity will be achieved earlier. We need to target about 5,000 vaccination sites, though, so that we'll be able to have the herd immunity by November or December. Unfortunately, mataas yung vaccine hesitancy. 6 out of 10, yun ang problema. And basically, the reason is about safety. May perception sila hindi safe, may preference sila ng vaccine, meron ding ayaw talaga, no? Kailangan mapaunawa natin sa kanila yon, or else hindi sila makakabalik sa dati nilang buhay. Well, alam nyo, na-suspend for a while ang Astra because of the blood clots. But look at naman the cases lang in about 1 million vaccine. Ang liit-liit, 0.004. Pag nga nagka-COVID ka, almost 165,000. Pwedeng magbara ang heart mo, magka-stroke ka. Ngayon, I had a patient na nagkaroon ng stroke. COVID yan, ano? Mas mataas pa nga ang blood clot when you smoke and pag nagtitake ka ng contraceptive pills. So, it's really counterintuitive na i-ban natin for a while na ban ng AstraZeneca because the benefits will outweigh the risk. And the reason why I'm saying this because nakita na natin na working in the industry, looking at the studies, masyado mababa yan. Kaya lang, in the world, in the social media world, one case lang na ma-magnify. Yan ang nagiging problema natin. Now, sa Pulse Asia survey, kailangan nating maayos yan. maibaba natin dapat yan. And very important. Now, ito yung mga side effects, no? Gusto kong sabihin sa inyo. You will only have pain at the site of injection. Ako, I use paracetamol and anti-allergy an hour. Tomorrow, I'll take that an hour before the injection. I never had headache, wala akong fever, wala akong fatigue, wala akong chills, joint pains, and side effects. And if ever, very mild side effects yan. And the side effects are a sign that the vaccine is working to jumpstart the immune response, and they will pass after 24 to 48 hours. Now, mga kaibigan, ladies and gentlemen, this is a huge elephant in the room syndrome. Ang ibig sabihin doon, there's a problem but we refuse to see it or we ignore it. Na i-ignore natin na ang bakuna talaga ang magpapa-open na economy. Because the bakuna will control the virus spread by herd immunity. Now, if we don't understand it, then we're part of the problem. So yan ang nakikita ko. Now, the COVID vaccination program is the largest and the most complex public health effort in the history of the Philippines. It will benefit the poor, the most vulnerable among us. There are 14 diseases we've controlled, and thanks to these vaccines, ginagamit natin sa pag-anak pala ng mga anak natin. So why not, ba't tayo hindi ngayon magpabakuna? Kung hindi nagka-polio mga anak natin, hindi nagka-measles, natulungan tayo. Now this is a time to change that particular mental attitude. Now, so in conclusion, my dear friends, it's a blessing from the Lord that we have safe and efficacious vaccines against the COVID-19. We should all be vaccinated, not only to protect ourselves, but our families and co-workers, particularly our parents and our elderly loved ones. Now, with vaccination of the 70% of the population, we will achieve herd immunity. And we want to be part of this particular herd immunity. And with herd immunity, we'll be able to reopen the economy and bring back our lives to normalcy. Now, look at this herd immunity graph. Pagka 0%, that is the infection. Wala pa tayo sa 25%. But look at 50% and look at 75% herd immunity. Pag ang vaccination natin ganito lang ang mangyayaring infection natin. Hindi ganito. Kaya hindi tayo makaalis-alis eh. But US, UK, okay na sila in Israel eh. Now, in the future, we will be requested to have an immunity passport. Like sa European Union, kung hindi tayo bakunado, we will not be able to travel. And you know, ang immunity passport ay ating key to economic recovery. The Philippines will be isolated from the rest of the world. Nakakaawa tayo. Tourists will hesitate to come. We will not be able to engage our international business colleagues. Filipinos might not be able to be given passes to travel abroad, particularly OFW, and even our favorite family and leisure travel na pag-iipunan natin, and our competitiveness will even sink further because even the poorer countries are vaccinating, no? Now, if you really want to save the country, meron tayong dalawang contribution. You need to get vaccinated or do testing. Pinapaliit ko lang ang problema natin. Get vaccinated and do rapid testing kung kailangan nyo yung gawin so that you can help the country. But we need to have a measure of success. And according to Peter Drucker is a management guru. You cannot manage what you don't measure. So we really need to have this particular scorecard dashboard with us. Now, ang question natin sa dashboard natin, is the viral transmission controlled? No. Kung traffic light scorecard were still yellow, are the system capacities in place? Testing, contact tracing? I don't think so. So I think this is yellow. Work in progress. Are the outbreak risks minimized in special settings like the hospitals and nursing home? This is yellow, parang traffic light. Preventive measures are in place in the workplace. I think this is yellow to green kasi yung work, except for the bakuna, because I think the workplaces right now are aggressive. And then with the approval of the vaccine for 12 to 15 sa Pfizer, that is a silver lining. No? So this is actually yellow to green. Importation risk, I think yellow, kasi we're so accommodating as citizens. Nagpapapasok tayo ng variants. I think we need to check on our borders. Are the communities fully educated, engaged, and empowered? I don't think so. Ang taas ng vaccine hesitancy natin. Siguro yellow ito. Maraming merong misinformation, maraming naniniwala sa fake news, no? Yan ang nagiging problema natin. Now, alam nyo, nakakaawa to, no? Kaya ako nilagay itong slide, no? Maliit pa ako at ganito na ang trabaho ko. Napapagod na ako mag-araro. At talagang ganyan na mangyayari sa atin kung ang kalusugan natin hindi maiintindihan. Pero kakayanin natin. I think health is the new wealth right now. And we owe it to our kids and the next generation of Filipinos. Kung tayo lahat ay mababakunahan, then we can open the economy. And there will be less Raymark Mariano na nakakaawa, hindi makapag-aral, hindi makakapagtrabaho. Diba? Very important yun. So how do you end the pandemic? Well, you have two choices. You can go to the simple but wrong approach and you go to the end of the cliff. Or you can choose the complex but the right one. Wearing the mask, doing social distancing, and having yourselves vaccinated. Later in life, no, I'm manganganak ko yung first yung anak ko ng aming panganay, si Micah at si Pia. Perhaps by tomorrow, May 27 ng EDC. And pag lolo na ako, 20 years from now, I will look back in time and say, Lolo, sabihin sa akin ng apo ko, where were you in the summer of 2021? Were you on the wrong side or on the right side of history, arguing with the world, was crying out for a solution? So I will tell my apo, I played a minor role in that particular advocacy to find an end for the pandemic. And your lolo was on the right side of history. And I was arguing to find out a solution for the country at that time. So my favorite, of course, character is Harry Potter and Dumbledore. You know, we can make a choice to live as social responsible citizens or descend into anarchy. We can make a choice to follow or break the rule. We can make a choice to be right or wrong. But it is not our abilities that show that what we truly are. Maaaring tayong matalino, maaaring tayong mayaman, but it has us choices that will determine kung ano talaga tayo. Now, is your choice right or wrong? I don't know. But if you have a choice, my choice is to have yourselves vaccinated and of course follow the health protocol. I still believe there's good in this world. And I do believe that every day of my life. So this is my last slide and thank you for listening. Stay home and stay safe. Thank you very much.
Thank you, Dr. Lichon. That was a very straightforward update on our country's response to COVID-19. One thing that really struck me or really stayed on my mind is you reminding us to remember the 4 pillars on how we can control even without the vaccine yet. So while we are waiting for the vaccine, it's good to remind everyone that we need to get tested, we need to isolate, we need to trace, and continue doing the quarantine. This is to prevent, of course, the spread of the virus as well. So now we are now activating the live Q&A box to accommodate your questions for our guest speaker. So please write down your questions in the Q&A box below. So for those who do not know where the Q&A box po, you can hover your mouse dun sa screen that's beside the raise hand button. So, Doc, I will start na po with our first question. So, I've seen a lot of questions in the Q&A box na. In relation, since you are scheduled to have your second dose of AstraZeneca, our first question is, can the second dose of AstraZeneca be administered 16 weeks after? So, WHO only approved 10 to 12 weeks.
It's 12 weeks because before, ang unang study kasi niyan, it was good for half doses eh. Kaya na-late siya in terms of registration. AstraZeneca was supposed to be launched sometime in December. Ang nangyari kasi, when they use the full dose, mababa efficacy rate. But when they use the half dose, mataas ang efficacy rate. And then, the UK at that time was short in supply. So they want to cover a lot of Britons or patients using the single dose. So they made another study if they can prolong, not yung 4 weeks, but 12 weeks. But to their great surprise, mas lalo nung naging effective when they actually extended that to 12 weeks. No? So 16 weeks, we don't have clear studies on that. No? But 12 weeks on recommendation, if you look at the DOH data and the CDC, is at 12 weeks. No? Now, in terms of the antibodies, based on the mRNA studies of Pfizer and Moderna, you have antibodies up to 6 months, no? And I think ang prediction ko dyan, we will have antibodies until 1 year. And after the first 2 doses natin, or the first dose of Johnson & Johnson, we need a booster dose yearly so that it will just be an ordinary cold so that we can actually prevent hospitalization and, of course, deaths in the future.
Thank you, Doc. So it's still 10 to 12 weeks ang recommended for AstraZeneca. So we have another question here. What is your take on the green lane policy? Starting early this year, if balikbayans are fully vaccinated, why can't they be exempted from the 10-day quarantine?
Ako, I'm not supportive of that kasi hindi tayo pa nagkakaroon ng herd immunity. Even with the CDC in right now sa New York, hindi na sila nagmamask. Maybe it's too premature. I would be confident if I will have 50 to 70% of the population. Like in Israel, they ditch already their face mask. But the green lane, laging ang DOT aggressive to a fault kaya ngayon, nagkalat ngayon ang COVID natin all over the country. We have 10 regions right now. At risk, nag-MECQ na sa Iloilo and other countries. And yesterday, Senator Migsubiri calling out right now for an MECQ. And Negros Oriental, the doctors are calling for an ECQ. So in the midst of crisis, this is not the time to relax, no? I don't think, di ba sinasabi ko na if the cases are not yet controlled, this is not the time to relax our restrictions. So my answer, I'm not supportive of that, but later in the future, perhaps I will support that.
Thank you, Doc. Another question, is it safe Moderna vaccine as my sustaining vaccine after getting Sinovac or AstraZeneca for my first 2 vaccine doses? I think it's for the booster.
So if you took Sinovac and Astra, ako, well, just to tell you, there are many great personalities ng Sinovac. Dr. Gap Legaspi, the PGH director. You have Edsel Salbanya, a famous infectious disease expert. And of course, the FDA chief, Eric Domingo. And of course, Secretary Galvez. Ako, Astra, na-assign sa amin sa hospital. But I would choose an mRNA booster dose later on because of its effect on variant. Lahat kasi ng variant covered niya. And in the future, if you want to travel, the European Commission already declared that they will honor travelers who would have been fully vaccinated with mRNA vaccine, AstraZeneca, Johnson and Johnson, and Sinopharm. Ang Sinovac is for evaluation. Kaya ang payo ko, if since ang available sa atin dominantly because of the inventaryo, very high ang ating Sinovac and Astra because of the preference of the government on Sinovac, and COVAX naman Astra, and Coconti ang Pfizer. Your booster dose should be, to me would be an mRNA vaccine, and they will be coming, I think, third quarter of this year kung if you had started with your Sinovac or your Astra doses.
Okay. So another question, Doc, is what are your thoughts on the Covaxin by Bharat in India?
Well, ang comment ko lang dyan, baka ma-delay because of the problems in India. And baka magkaroon ng vaccine nationalism. Siyempre, kung if they are in crisis, then they would only take care muna of themselves like nangyari sa US, di ba? So when they were in crisis, hindi muna namigay ang US ng Pfizer and Moderna. Ngayon natin na nakukuha because they will be having the herd immunity in July. So that's a good drug. Ang problema, that's a good vaccine. Ang problema lang natin is sustainability of the particular vaccines, considering India will be needing all the vaccines that right now in the market.
Okay, thank you for that, Doc. Another question, if vaccine efficacy or protection from severe disease or hospitalizations are the same, why are there countries who only recognize a few?
Let's say Sinovac, 14 countries, no? Well, I've worked in the industry for almost 2 decades, no? And it's because of the limited affiliation. Ang Pfizer, 150 years na in the world, Ganon din ang Astra, siguro 100 years. New kids on the block kasi ang China and Russia. So, yun ang problema, kukonti ang kanilang affiliation. For example, walang branch dito ang Sinovac is a distributor lang or Sinopharm. Samantalang as a multinational company, meron silang affiliate or branch dito. So, ganun ang explanation doon. So, that's my answer to that particular question. Did I answer it correctly? Hindi ko lang kung tama bakit hindi sila distributed all over. Kasi 14 lang po And I think it's available in Turkey, Brazil, Indonesia, I think Thailand, Chile, yan. Yan yung mga countries And of course, hindi of course for political reasons, naman Europe might not be able to accept it right away, and even America. Di ba sa America, 3 pa lang vaccines nga ang available, Pfizer, Moderna, and Johnson & Johnson. And even Astra, hindi pa nga tanggap sa Amerika So, what I'm saying is that may preference ang bawat countries. And of course, naman their diplomatic relationship Kaya the vaccine is all about diplomacy. It's all about politics din. So, makikita niyo yung interplay niyan. Kaya ganun ang situation.
Okay, so I hope we were able to answer yung question directly, Doc. So we have a question from Mr. Michael Encarnacion from Cebu. Actually, 2 questions po ito. Here in Cebu, some restrictions have eased out. Example, travel and liquor. So that said, people are more freedom roaming around. So for people who are fond of going out, meeting new individuals, and perhaps sexually active, what are the do's and don'ts? Will having been vaccinated give more confidence in being able to do activities pre-COVID?
Alam mo, Michael, I was in Cebu during the time na nag-lockdown ng ECQ. Kasi during that time, we were doubting yung data noon And we visited Cebu. I was there. Sinalubong kami ni Governor Gwen, ni Mayor Labella, and the businessmen. Nalaman ko at the time, puno na yung mga hospitals doon. And that was the time when I was ousted from the NTF because I revealed the data were not accurate at the time. Ang pinapadating na sa Manila at that time, okay daw tayo. Pero hindi pala. So we had this meeting in one particular Montebello. So some of our friends from med school dumating doon. Sabi, uy, naku, puno yung mga hospitals namin. Hindi lang namin masabi because the political leaders here and the businessmen would like na open pa rin ang business. No? Now, and then suddenly, pumunta ang IATF. Diba? So I revealed that on Twitter, the rest is history. Tama pala ako. Nag-ECQ kayo for almost a month. And then dumating pa dyan si General Simatu with tanks all over the place to discipline the Cebuanos. Remember? All right. Now, you know, our lives are different right now. We cannot be back to our normal lives. Yung sinasabi natin. We're definitely not out of the woods. Kung makikita mo, I go to the clinic, 4 times a week. I have a rest day, Monday, Tuesday for advocacy work and lectures and telemedicine. Because it's not yet normal. You want to boost up your immunity on certain days, no? Now, kung meron tayong cavalier attitude like ni Donald Trump, then we will be in that particular problem then. So my advice to all of you, if you want really to go back to your normal life, get vaccinated and then wait for the announcement of the government kung meron tayong herd immunity. Pagka na-reach na natin yung herd immunity, then we can bring back our lives to normalcy. It's difficult, no? But it's the reality that we're facing, considering our vaccine supply is not yet sustainable. So that's my first answer to the first question. I don't know, meron pa siyang question.
Meron pa po. Another question po on vaccines. When you discuss of efficacy rate, is the population tested more composed of medical professionals, or are these figures based on of our regular citizens? I'm asking because some people are hesitant of getting vaccinated because figures are not 100%.
Well, kasi sa clinical trials kasi, when you mean clinical trials, limited pa kasi in the real world. Kukunti pa yung mga population yun. Kaya you test that in the real world. Ang tawag din effectiveness trial. So, for example, you do clinical trials, multi-center. Yung study, kaya nun, ang Sinovac was approved for 18 to 59. And hindi siya approved for healthcare workers and senior citizens based on the study dun sa Brazil study. Mababa yung efficacy rate, mga 50% lang. Pero high in Turkey at around about 80%, in Indonesia 70%. So the initial indications given by the FDA, if you remember, 18 to 59 lang siya. And then not approved for healthcare workers kasi at risk sila. So they might need a higher efficacy rate. And then hindi pwede sa senior citizen. Pero after submission nung dumating yung Chile study, nakita nila there are merits for senior citizen. That's why na-revise yung FDA indication for more than 60, right? And then healthcare workers, itong latest sa Indonesia, tin-track down nila using Sinovac. Ang galing, 99% na inobserbahan nila 25,000 workers. Walang namatay, walang na-hospital. So what I'm saying right now, ang effectiveness ng Sinovac in the real world dumalabas na ngayon. Medyo na-delay lang sila because their company is not as big as the Pfizer na nakakapaglabas kaagad ng effectiveness trial. But if you want to say Sinovac is effective in the real world, I will tell you it's effective in the real world.
Okay, thank you, Doc. So I have another question from Lorna Pabelico. In your opinion, should the COVID vaccine be done yearly or every 6 months?
Ang tingin ko so far, 6 months muna yung data. Pero the US is studying kung sana ma-extend to 1 year para hindi naman tayo every 6 months.
Every 6 months.
Oo. So far, ang nakita lang, effective for 6 months ang Moderna. Tingin ko yun na yun. Ang magiging, I think it will be just another vaccine on a yearly basis. Ako, every year, nag-vaccine ako to protect myself rather than be hospitalized. Ako, working in the hospital for many years, I never, for good reasons, hindi ako nako-confine. Hindi ako nagkakaubo. I mean, hindi ako nagkakaubo. It's because of the protection na nakikita natin. No? So, ang prediction ko, my bold prediction, 1 year. Ma-extend ang power ng bakuna to 1 year. So every year magbo-booster dose tayo. And then eventually magbumura ang booster dose kasi mahal lang siya sa umpisa ngayon dahil in demand di ba? The law of supply and demand. But eventually magbumura yan. Yan ang aking prediction.
Thank you, Doc. So question from Aguilar Bong. Why were the variants allowed to come in that caused the surge in March?
You better ask Secretary Duque, ba't nila inalaw yan? Ako, you can see in my Twitter and also sa Jolly, February 11. Ako kasi, my usual hobby is reading global news. I like to read global news Kasi I can get the best practices But kapag magpapakahirap to reinvent the wheel for policy, you just have to read what Israel is doing. So nakita ko kaagad, may variant ka ako ang UK. Ito ginagawa nila. Nabasa ko na in January. And then nabasa ko in South Africa, February 11, Philippine Star, yung nagtanong, i-google my name. Ayaw nila. Sabi na, wala pa naman dito sa bansa natin Sabi ko, ano ba to? Do you have to wait na makapasok dito? Nakapasok na sa akin. Sorry It's ridiculous na prevention dapat Di ba? Ano nangyari? Pinapapasok muna. Tuloy, nagkaroon ng transmission. So, sorry guys I don't know. We're so hospitable even to variants Filipinos are hospitable. Sana naman for good reasons, but not for variants. Sorry. Ay, nako. I cannot explain yung laxity in terms of being accommodating to variants. Sana it would be the last. Kasi napasok na tayo ng Indian variant right now. Pero, may silver lining, remember, some vaccines are effective for all the variants. Nakita niyo yun. And I have my slides na share with you. Bibigay sa inyo ni na Luisa, no? After this, no? In PDF file, no? So that you can read, no? Baka makalimutan niyo kasi. Alright. So may silver lining for the variants, no? Okay.
Thank you din, Doc, for sharing it with us yung table mo of the vaccine that works on each variant. That's really well noted dun sa presentation. We have an anonymous question. Can pregnant women be vaccinated? What would be the best practice for them?
Alam nyo, my daughter-in-law, Buddhist in 2 days time, baka mga anak na, EDC yata niya May 27. Studies are positive regarding that. Pero ang sinasabi nila, since protected naman sila, wag na muna, pagkaanak na lang tayo magbakuna. Kasi alam nyo po, in clinical trials, ang pinaprotektahan ay 2 population, less than 18 at saka buntis. Kaya makita nyo, mga studies would start at 18 to 59. So, ang tagal ko pong nasa Pfizer for 2 decades. I went to New York and pumupunta tayo sa mga laboratories talking with scientists. Bakit ganun? Number 1, vulnerable sila you have to prove muna in normal individuals and adult that these are safe before using it in pregnant and sa young ones. Kaya after na ma-prove nila nating safe sila sa adult, ginamit na natin sa 12 to 15 to 18. Kaya pag na-inject na yan, makakapasok na. Yay! Ang mga bata. No? And then susunod, mag-aaral na sa pregnant women. Pero I heard it can penetrate to the breast milk. Safe naman daw. No? Pero itay natin ang definite ang studies. No? Kung mga pregnant naman, hindi naman lalabas. Eh. And then kami lahat dito may herd immunity na halos lahat kasi lahat ng anak ko and all. So you actually, ang suggestion ko, you better have a family herd immunity. Let's say 10 kayo na family, 70% na bakunahan. Then you protected ang daughter-in-law ko. Ganun na ibig sabihin ng herd immunity. So paliitin natin ang problema natin. So kung mababakunahan ang 70% of your or 50 to 70%, then protected din ang daughter-in-law ko. Hindi siya magkakasakit. But after delivery, surely, papabakunahan siya kaagad. Ang husband naman niya, my son, nabakunahan na kasi siya ay may hypertension, mild hypertension. Nasa A3 siya, A3 siya. Na-stress yata siya for the firstborn.
Okay, Doc Tony, we are down to the last 3 questions. So from Mr. Ricky Gumaru, what can we do as ordinary citizens? To push government testing and make it free, increase testing and make it free, contact tracing, increase daily vaccination, and other citizens stay home, social distancing, trace, quarantine, to do the right thing?
Alam mo yan, that's a very nice question. Alam mo, there's strength in unity and there is strength in numbers. No, halatang fan ng fan na tayo ni Steph Curry, di ba? And ng Warriors, di ba yan ang kanilang Alam mo, I believe in social media strength. Siya nag-shape ng decision making process ng presidente. Tingnan niyo pag nag-trending, napepersa silang mag-decide. So I suggest guys, stick to the science part. Laban niyo yan, testing. Punta kayo sa Twitter ngayon. Ang daming sabi ko mali yung pag-report nyo. Nagte-trending. Nung nag-post ako about AstraZeneca mapapanis, biglang bumilis ang pagtatrabaho nila, matatapos kaagad nila. So what I'm saying guys, you go to your social media network, mag-enroll kayo for Twitter, Facebook, Instagram. Lahat tayo pag ginawa yon, we are stronger as rather than one. Pero okay rin naman yung one. Kasi each one naman is part of the whole thing, di ba? So what I'm saying, believe in the concept of science. And at this point in time, be socially relevant kasi kailangan tayo ng bansa ngayon. Your opinion can add up to the many who are actually crying out for change and social change and for testings, tracings, and bakuna. So kung lahat tayo magsasama-sama, I think will be a big force. So I'm on Twitter, and Facebook. Ako dati hindi ako mahilig dyan . Nakita ko lang yung power niyan nung nag-start tayo sa COVID. Dahil at that time, sabi ko, paano ba to communicate to the public? Hindi ka naman makalabas, di ba? So I thought of doing Facebook and Twitter. Nakakakita mo, ideas are actually the currency of the 21st century. And don't underestimate your ideas because some of your ideas can be policies in the future.
Okay, thank you very much, Doc. So we encourage everyone to practice what is that what we are doing. So to yung 4 pillars that you mentioned earlier. So last 2 questions from Aguilar Bong again. Assuming the course of the country take the course the country takes is what is expected, how soon would you think the business will become more or less normal? I ask because as an employee of the company, we need to predict how we will move on for the next months and years.
Ang prediction ko kung NCR plus lang at dumating ang Pfizer Moderna, 13 million kasi NCR eh. Ang NCR, yung plus, 13 million din. Kinumpit ko na yung 4 provinces. 53 million. No? So 26 million, 70%. 18 million. Kayang-kaya. Pag NCR inuna natin, kasi siya ang center of the contagion at saka ang business epicenter natin, I think we'll be back by December kung NCR plus. And then go to the hotspots. Ngayon, kung all over the country after the NCR plus, I think end of 2022 after the term of President Duterte na. Kasi archipelago kasi ang setting natin, ang hirap magdala ng bakuna in far-flung areas because of the cold chain. You remember yung sa Cotabato, na wala ng ilaw, walang generator, nabulok yung 248 na bakuna. And then dinala sa Quezon, dumubog yung vapor. You remember? It's difficult, no? Kaya ang tingin ko, nationwide, end of 2022. So, ibig sabihin, next year na yon after Christmas this year. Kaya kung magpapabakuna tayong lahat, mas mapapabilis tayo. Pero tingin ko NCR Plus, achievable November, December of this year.
So we are going to read the last questions. Apologies that we are limited na po tayo sa time. So we're just gonna read the last question from Mr. Charles Marasigan. So hi Doc, given po that 12 weeks lang ang allowance, what would happen if the second dose gets delayed, especially given the current situation in the country?
Sa Astra? Sa Astra ba yun?
I think this is in reference to Astra po.
Okay. Kung madelay ka, okay lang yon as long as you complete the immunity. Kasi sa first dose, 90% ka naman protected. Sa first dose, on the first dose and the second week, 90% protect. Ako, di ba? 90% na ako eh. Kaya naman natin gustong second dose for completeness. So wag ka mag-alala kung ma-delay man siya. Kung ma-delay siya, you take another vaccine para yung booster mo na. You take another vaccine. Dumating ang Pfizer Moderna. Diba? Meron na study sa Spain, yung mix and match. Ang first yung dose ay Astra, tapos Pfizer yung second dose niya effective. So meron na namang study na. So kung naubusan ka na ng Astra, di makadating. Pagdating ng Pfizer, ang suggestion ko, you take the second dose as the Pfizer. Kasi there's a study right now in Spain that you can actually mix and match.
Okay, so once again, thank you, Dr. Lechon, for helping us know more on the current state of the Philippines and the benefits of the vaccine during the pandemic. Certainly, our attendees have gained valuable insights in our fight against COVID-19. We truly appreciate you taking some time for this webinar. So to wrap up today's online event, may we call on screen the Head of Direct Sales of Generali Philippines, Douglas Sanchez.
Can you see me? Hello? Hello, can you hear me?
Yes, Douglas.
We can hear you.
All right, I cannot see my video. So anyway,
we can see you, Douglas.
Okay, thank you, Luisa. I hope you find the webinar worth your while. I will not hold you any further. I just like to make some messages to convey. First, if a coronavirus vaccine becomes available, regardless of which one, take it. It's nothing but good news for you. That would end the pandemic. Like what Dr. Tony mentioned, the benefit of getting the vaccine outweighs the risk of dying with COVID. So herd immunity will only be achieved if everyone is vaccinated. So please register at your LGUs, get vaccinated so that we can fully open our economy again. Second, while waiting for your turns for your vaccination date, stay safe and observe protocols and keep your family protected at all times by giving them peace of mind. General is with you throughout these difficult times. We remain to cover COVID-related cases, its diagnosis, its treatment, even its adverse reaction to vaccine, except for the cost of vaccine at this moment, and its administration because it's not yet commercially available, and it's locally provided by the LGU for free. However, as soon as the vaccine becomes commercially available, Generali shall be open and looking ways on how to facilitate the vaccination for our members. We also recognize the increased need to support our members during this time of pandemic. Studies shown that increased level of anxiety, depression, loneliness brought about by the quarantine that reduces employee productivity. So in general, we help address this issue to our mental wellness program, which provides online assessment to our members and to assess their health and mental condition. And if needed, members can also do an online consultation with our psychologists for early intervention to treat and manage. Also, if you feel that your current coverage is not enough, we have a voluntary plan. It's a top-up plan to augment your existing coverage on a voluntary basis. However, or furthermore, you can also cover extended dependent, which is not currently covered under the main plan as an eligible dependent. So we're talking about parents-in-law, nephews and nieces, and it's very affordable, which is unique in the market and not available elsewhere. And now we are currently looking at the inclusion of home healthcare, especially that hospital bed capacity is full. It's a program which includes monitoring and management of COVID patients at home. And in addition, we are also looking at working on home laboratories for people under quarantine. We can send someone at your doorstep to perform the laboratory procedures. So these are just some of the few innovative services we can provide to help our members, cope up with the pandemic. Should you be interested to know more about the programs, feel free to contact our account officers. So on behalf of Generali, I would like to express my appreciation to all participants for taking time out to attend this seminar. Special thanks to Dr. Tony for sharing. We learned something about the COVID vaccination program. Wishing you to be vaccinated soon, and for the meantime, stay safe at all times, and thank you. Back to you, Louise.
Thank you, Douglas.
Yeah.
So there you have it, everyone. On behalf of Generali Life Assurance Philippines, thank you for joining us today, and we look forward to seeing you again on our next webinars. Once again, I am Luisa Espinosa of Generali Philippines. Thank you and have a restful day ahead.
What do you value most in your life? Your family? Your friends? Your career? Where do you spend most of your time? At home? At work? Online shopping? No matter how big or small your priority is, you can be an influence who make a lifetime impact to the people you value the most, to the things you care about, and even to the places you step into. At Generali, our priority is you. Taking care of people is a tough business. Companies thrive and succeed based on how happy, productive, and excellent their people are. We know this is your job, to help companies take care of their people because people take care of their companies. We hear you and believe in you. Our commitment is to be your lifetime partner in securing the future and lives of the people, your people that you value. Because what you value is important to us. We take every opportunity to intricately learn and administer ways to help you provide the best solution to improve their welfare and to progress in life. Over the years, Generali has grown to be a leading life insurance company anchored in the preserved Italian culture that has brought its fruit to various international countries, including the Philippines. Today, we continue the legacy committed to being your lifetime partner as you become your company's partner in enhancing the lives of your people through these customer-centric products and innovative services. Ease your worries on what might happen through group life insurance. Have your employees be health secured with a comprehensive medical coverage. Worry less now with the group health insurance. We will never know when an accident might occur through the group personal accident. Reduce the risk of having unpaid loans through the group credit life. Worry no more when your employees get diagnosed from any of the 21 identified critical illnesses through the group dread disease. Moving forward, you can now easily access our products and services right at your fingertips through our digital platform. Generali wants to take care of you by helping you take care of the people around you. Our commitment to deliver on the promise that we are your lifetime partner that you can trust and rely on will continue.
All of this we're doing to attain our aspiration to become a lifetime partner to our customers, distributors, and employees. This is our commitment and we will stay true to it.